Hi, my name is Araba Wuba, and I am the main Credo support liaison. And in today's video, I'll be showing you just a few quick tips on how to enter your patient encounters. There will be a more in-depth patient encounter video, but this is just to get you quickly started and just a few tidbits that you may need to know. So once you've gone to credo.education and you've logged in, you'll go to patient encounter, and this will show you how to enter your patient that you are seeing. So you'll enter the gender, the age, and your interaction class, and then you have notes and history. For each patient that you see, you'll only need to enter the pertinent history for that patient. So even though your preceptor may have seen this patient for a longer period than you have, you do not need to enter all of the history that the patient has, just history that you feel is pertinent to the diagnosis that you are about to enter. So I will show you how to quickly enter a patient. Say I have a female, she's 23, so she's going to be in this age range, and saw her in the hospital. I'm going to quickly save that, and then this will pop up for you, primary diagnosis. And so here are just a few quick tips that I have for you. General wellness checks, according to the World Health Organization, are categorized as diagnoses. They are not procedures. So, if you have seen a patient and they do not have any abnormal findings and they are an adult, the code for that is Z00.00. And as you can see, that code pops up. For a patient that is a child, let's say, obviously this person is not a child, but the code for a general wellness check for a child is Z00.12. And you can see you have the option of selecting with or without abnormal findings. Another code that can be found under diagnosis, even though it is a procedure, is a pap smear. So you can either enter pap smear, or you can enter the code Z01.41, and it will show you the different options that you have. And so in this case, this is a pap smear with a normal gynecological examination. For one without a gynecological examination, the code is Z12.4. Encounter for screening for malignant neoplasm of cervix. Another code that is also found under a diagnosis but is a procedure is a mammogram. And that code is Z12.31. And this will show you the code for a mammogram. And last but not least, for plastic surgery rotation, most of the codes can actually be found under Z41.1 for diagnosis. It's under diagnosis. There are a few procedures that you can find under procedure, but the World Health Organization considers most cosmetic procedures to be a diagnosis. So the code is Z41.1. And so I just wanted to give you just a little bit of information about ICD-10 codes. So as you can see, I've said an alphanumerical digit, so you have A, B, all the way to Z, and then you have two numbers, and then point something. That is the ICD-10 clinical modification code. That's primarily for diagnoses. And so you can either type in the code itself, or you can type in a keyword that you may have, and you can select that. So I'll just select cosmetic surgery. Let's say that this patient got it. And so I want to show you what a procedure looks like. So you can use a keyword search, and for instance, let's say you did an X-ray. For Credo, you need to put X-ray into quotations, primarily because the code that we use sees the dash in X-ray and it doesn't really know what to do with it. So in this situation, you do need to put X-ray into quotations, and it'll show you all of the appropriate codes with the term X-ray in them. And if you look quickly, you can see that the codes do not have digits in them for procedures. This is the ICD-10 PCS code, and this is obviously different from the CM code. It's the Procedural Classification System is what the PCS stands for. And so it ranges from both alphabetical to numerical digits. So you can have 0 up until, I believe, 9, and then you have various letters, A, B, C, I think H, Z, it varies. You can look that up on Google if you please. And so I'll just pick, she got an X-ray on her spinal cord, and you can click Save. If you are having any issues with finding a specific code, like if it doesn't pop up in the keyword search and you've been looking for quite some time, the best way to go about finding that exact code is to go to Google and type in whatever your diagnosis may be and ICD-10 code for a diagnosis, ICD-10 PCS for procedure, that makes it more accurate, or the chemical name of whatever drug you may have, and then WHO space ATC, that is the chemical classification that the World Health Organization has for prescriptions. And so those are just a few tidbits that I have for you. Of course, if you have any synonyms that you believe should be in Credo, you can send us a support request, which can be found on the main page. Thank you for watching, and have a great day.